Across the country, we have seen more than 1,000 cases of the measles. Here in Texas, those cases exceed 700. The CDC says almost all the infections involve people who are not vaccinated against the measles. KXAN's Sally Hernandez talked to a former CDC director for a closer look.
There have been some significant cuts as well to public health. Does that have anything to do with what you're seeing out there?
It's a huge impact. The Texas health officials are trying to do the right thing. The federal government, though, has pulled back hundreds of millions of dollars from Texas alone. And that's led to the cancellation of some vaccine clinics in neighborhoods where there are lower income people. That costs a lot. The health departments have had to let some staff go because of those cuts and cuts to the Federal Centers for Disease Control. That all plays a role. So with measles is probably one of the most contagious viruses that we know. And so you have to have vaccine coverage rates of above 95% in a community for it not to spread. When it drops below that, it starts to find people who aren't vaccinated, and it starts to spread. And unfortunately, we've seen people lose their lives from that, and I think we're going to see more.
More people lose their lives from this?
I believe that's going to be happening because the other thing about viruses, while the vast majority of these cases are in Texas, viruses don't respect borders. So as people travel, the viruses travel, and they will set up shop and they will spread in every state, but in particular in those areas, in those communities where people are questioning vaccine safety.
Are people just not trusting the government as much as they used to?
Well, trust is a major issue. With the COVID pandemic, it was the first pandemic where we saw that kind of politicization, where you saw a division based on politics in terms of whether people trusted public health. We need to make sure that people recognize that while it's a personal decision to vaccinate your child, it's one that affects the other people in your family, your neighbors, those in your community. So talk to your doctor, get your questions answered so you can do the right thing in terms of protecting your children.